This is the Polaski Center of Excellence, and this is the Michael Polaski Pediatric Hospital, which is currently under construction. And Michael Polaski Pediatric Hospital has come to being through the courtesy of the Polaski family back in the US. And this hospital came to being due to the fact that we have so many children that are not able to access very good healthcare services. And the hospital has currently been under construction. We are hoping when the hospital is completed, we should be able to attend children both from this region and outside this region, being maybe the third pediatric hospital in the country. And we will be offering different services in the hospital, from curative, mainly targeting children who are living with HIV and AIDS. We should be able to offer the psychosocial support. We also hope to have a gender recovery center for cases of sexual violence of minors. So we are hoping when the hospital is completed, we should have a capacity of 100 bed capacity inpatient. And outpatient will be treating both children as well as their caregivers. You don't expect a grandmother can come with a child and the child is treated and the grandmother is told to go home. So we'll be treating both inpatient and outpatient. But for outpatient, we concentrate on the children as well as the caregivers. But for inpatient, it is going to be strictly for children, and as well as making the services very affordable to the very needy children that have otherwise not been able to access good healthcare services because they could not afford it. So I will kindly request if we can go now and see different departments in the hospital and what we are going to be doing in the hospital. Yeah. So this is going to be our entry porch. When the people come to the hospital, they get to enter through this door. And then this is going to be our reception area. All the patients that will be coming into the hospital will come in through this entrance. Once the patient enter, this is the waiting area around this place. This is going to be our registration counter. And then on this other side, this is going to be our pharmacy. Yeah, so right this door here is going to be our triage. The nurses are going to be here and are going to be doing the baseline, and then they are going to enter inside there. And then inside this room right here is where we are going to have the doctors who are going to be treating the patient and doing the prescription. Everything is going to be carried on inside here. And then right here, in this other next room here, is where we are going to have the emergency. Any patients that are being brought in the hospital and maybe they need resuscitation, they are going to come in through that way, and this is going to be like our emergency room. This is also going to be one of our consultation rooms. So when patients come in that way, they get inside here, and then we have different doctors that are going to be seeing them inside those two other rooms that are inside there. This is going to be another diagnostic center. So all the laboratory services are going to be carrying on in this place. Malaria test, HIV and AIDS test, everything is going to be carried on in this particular room. Yeah. So this is yet another room. This is going to be the holding room. In any case we have any of the children, unfortunately, get to die while admitted here at the hospital, or maybe they've been brought in some emergency situations and we've not been able to help them. This is going to be a temporarily holding room, like a small morgue, where we get to hold the bodies temporarily before we take them into the mortuary. And that is why we have this exit door here. And this exit door will ensure when the vehicle comes around from the back there, we can have an exit through this way where the bodies are taken out from this particular place. Because we are not able to have enough money to put in a lift, and the government requires that unless you have 3 floors is when you can have the lift. We have the staircase around here where the children can, the ones who are able can, and then this is the place where we can use a trolley to troll the children up and about. And the ones who are not able to, but the ones who are able will use the staircases to go up there. Yeah. So this is our first floor in this hospital. This is going to be our nursing station. So all our patients that are going to be admitted in this floor, the nurses are going to be stationed right at this place. And we're going to have some drawers here where maybe the medicine that they require for the night and maybe their confidential files are all going to be stored right here. And then we have this same nursing station on the 2nd floor where we have more wards in the 2nd floor. And also right on my left there, we have the other nursing station, and as well as in the 2nd floor, we have also a similar nursing station. And this will be able to serve the patient admitted on this section. That other side will be able to serve patient admitted on that side. Likewise to 2nd floor, right and left nursing station. So this is going to be where the children are going to be admitted. The first one I just passed there is a ward. This is going to be the next ward. And in this ward, we're going to have about a maximum of 80 children that are going to be admitted here. Maybe mothers and their child. Yeah. So a maximum of 80 children can be accommodated in this room. So in this room, we require beds. And we require a small section where the nurses can be attending them from. So this section here, the whole of this section here is our theater. That is the recovery room. This is the main surgery room. And then right in this room here is where the nurses get in, the small office here. That is where they change, clean up, and prepare. And then this door that is right here is the entrance to lead the doctors into the main theater. Yeah, so this is about it, about the Polaski Center of Excellence and the hospital you have all seen. This is Michael Polaski Pediatric Hospital. So we are looking forward for your support. We require about $40,000 right now to be able to complete the hospital. And we are hoping you can be able to stand with us and give us the required support that we need to be able to complete this hospital and be able to bring in the children that you've already seen that are crowded in the other hospital that we just had a look. Thank you.